Sir, starting from here, I would like you to talk about what you actually do and the experiences you've had so far as a dietitian. And the same will go for everyone. Ma, you tell us the cases you've been seeing most often. Also, sir, the ailment you've been treating and all of that. Okay, so let's have you, sir.
Thank you, moderator. My own aspect of health in the hospital is to give dietary advice and also to treat ailments with the knowledge of science of food and to intervene to health challenge or challenges of patients that comes to the hospital. That's a summary. And the health cases that we have always been seeing in the hospital, they are numerous, but I'll just make mention of the common ones. One, the issue of diabetes and its complications. The issue of high blood pressure. We all know what is really happening in the country now. The economy is not as favorable the way we are operating that it should be. And all these issues do cause people to come up with all these health issues, which I've just made mention of, hypertension. And also, some patients too, they may come up with hyperlipidemia, obesity, that is too much or excess energy in their system, too much calorie in their system. Some people also may come up with gestational diabetes. That's diabetes during pregnancy. That happens during pregnancy. And also anemia. Okay? And we have different forms of anemia. And people come up with that. That is shortage of iron that helps to produce hemoglobin, which is the protein found in iron-rich food. When they don't eat enough food that is rich in protein, and any food that is rich in protein has iron. It's embedded with iron naturally. But when it is not well utilized, they may come up with such issues. And also, on the last note, asthma is also very common. Asthma. Some people are asthmatic, but they don't know what to do, where they're supposed to stay, where they're supposed to avoid staying, and many other issues. And on this last note, I'll talk about this. Peptic ulcer. Peptic ulcer, very, very common. Ulcer, very common. And ulcer can be any part of the body. The gastrointestinal tract, the upper part of the gastrointestinal tract, and maybe the lower gastrointestinal tract, which starts from your stomach to intestine, small intestine, to even to the anus. Okay? So let me just limit it to that, because those are the most common health issues. And also, malnutrition, most especially to children, when they don't feed well, when their mother don't give them food enough, and may lead to marasmic kwashiorkor, marasmus, kwashiorkor itself, and all many other health issues. Let me just leave it to that, so that because of
all right, I'm still going to come back to you, sir. I have some questions already. All right, Ma, can we have you?
Thank you for having me.
Yes, ma'am.
In my profession as a psychologist, what I observe that I've seen so far is related to stress in relation to mental health. Now, sometimes, because of the things we pass through, take for instance, maybe government policy. I will start from there. Then unemployment is there. We have different challenges. Like sometimes it could be lack of money, financial constraint. So from there, it leads to stress. And then the stress leads to lack of sleep. Then immediately you start losing sleep. Like day 1, you don't sleep. Day 2, you don't sleep. Or you start using drugs, inducing yourself to sleep. Then other health challenges start coming in. It starts from, sometimes it could lead to depression. And that depression could be in terms of low mood. You want to keep to yourself. You don't want to talk to people. You want to stay indoors throughout the day. Sometimes you lose interest in things. You don't want to relate with family. Just want to be alone. And it's on the high side now. Like some people, it leads to other illness like schizophrenia. Like we have others like anxiety disorder. That is palpitation of the heart. Sometimes it's not as if you're afraid of anything, but because of what you are passing through now, the emotional trauma, then you start having this heart palpitation, like your heart start beating very fast, as if the whole world is going to collapse on you alone. And then sometimes you just see that on the long run, it's not as if there is danger. Now, with all those ones, you are already bringing in illness to the body system. And in the course of that now, then you want to manage it. If you want to manage stress without going to a professional, then you have to, then the person starts withdrawing now. So most importantly, for what we see so far, apart from that, is we also see, for my own area of specialization, I deal with children that have special needs. Some parents pass through a lot taking care of children that are even normal child, so-called child. It's not easy taking care of 5, 4. And then you now have a special child, like you, the aspect of taking care of the person is there, your own self is there, and then if the marriage is not settled as well, it's like it's not balanced. So we see a lot, and then it leads to different, like all the time. I mentioned something the other time, like presently in World Health Organization, they observe that in Nigeria presently over 40 million of people have mental health related issues. And it's not as if it's because of many other things, but sometimes it's because of what we experience daily, like different things. So I would just like to stop there.
Yes, ma. A lot of questions are still coming from that. Thank you, ma. Thank you, sir. Let's have you, sir.
Thank you very much. Thank you for this privilege, sir. Thank you. Okay, basically, the kind of work I do at the moment is I'm into research. I'm privileged to work with a WHO project tagged Action Trial. So what do? We are testing antenatal corticosteroids on late preterm. What do I mean by late preterm? Some women during pregnancy, they deliver before term. Term pregnancy is from 37 weeks to 42 weeks, okay? So if it's after 42 weeks, it's post-term. If it's before 37 weeks, it's preterm, okay? Now, between 34 weeks to 36 weeks, we narrowed our sample to that particular population in that we will test corticosteroids, whether they will improve the outcome of the newborn baby. So I deal with pregnant women and the newborn baby. So we follow them up for up to 6 months to see the outcome of that newborn child. So in my experience during this research for the past 2 years, I've discovered that a lot of pregnant women don't even know simple booking parameters like their BP, what is your urinalysis results, what's your PCV, that's your packed cell volume, at your point of booking, what is your genotype, what is your blood group. Basic booking parameters, they cannot remember. Because we have some cases where they will come when they want to deliver and booking parameters cannot be ascertained. Okay? So, one thing I would like to stress is that as a pregnant woman, when you are booking, remember every result, every test you do, try to know what is the result. You never can tell. You may not deliver in that hospital. You may be referred to another hospital. You may travel to another state. Okay? That's one. Then 2, most women during pregnancy, they tend to ignore, I'm just giving an instance, they ignore their antenatal visits. So when they want to deliver, for example, we had a very a near-death experience for a woman, but thank God she made it. She came normal, no problem, no issue. In the night, around between 11, 12 midnight, they met her on the floor, stiff and foaming, eclamptic, like she was already convulsing. They had to rush her to theater to deliver. Not knowing that just the period between when she came that evening till when that incident happened, her BP already shoots unexpected, unprecedented. So like he emphasized, hypertension could really be a silent killer. We must work on that. Then, regarding newborn babies, what are the common things we see these days? Most newborn are born anemic. Perhaps the mother was not eating well, or she was not using her antenatal drugs, like her routine hematinics. Then, most babies become icteric, that's jaundice, first 3 days of life, so it's becoming very common. Then, most babies, interestingly, are born with malaria. So, we are also researching currently if there is maternal to fetal transmission of malaria. It's one of the research I'm also involved with. So at the moment, I mostly deal with pregnant women. Then to some extent in diagnostic, I'm also undergoing training in ultrasonography. I discovered that every day of my training, 90% of the people we scan, they have ulcer, but they didn't know. They have peptic ulcer, but they did not know. And then about 50% have excess gas in their gastrointestinal system, but they don't know, which could be due to worm infestation, then the kind of food they eat. Some of the food are rich in bacteria that are harmful to the body, but they don't know. This is poor hygiene is also coming back to dietitians. So you can see that whatever we are discussing today, they are what? They are linked. And I pray that God will give us wisdom to unravel them more.
Amen. Please, let's celebrate them. Please, I have a quick announcement. If you have a question, please, for our gift, pass it around. Give it to the ushers. They will be moving around so that we can take your question as we proceed. All right. So thank you so much. I'm going to come back to you, sir. I also did my personal research. I know that diabetics is, in fact, one thing that is really happening, and I've seen people with that. What even causes diabetes? How can you prevent it from at a small age? Initially, I used to think that diabetes is for old people, but just like our nurse was telling us yesterday, that even 15-year-old child or a small adult, what could actually cause this thing? And when you are saying this, I also want you to add, okay, how can we stop this from happening to us? How can we cut down what? So over to you, sir.
Well, in the last 2 weeks, I just want to cite this as a scenario. There was a girl they brought to the hospital. The girl was still young and a teen age, but having diagnosis of diabetic ketoacidosis. That is the complication of diabetes. Not well, diabetes not well treated in the first place and has leads to complication of ketoacidosis. That is, the body system produces acid. Are you getting me? And the body is now using fat to generate energy. Are you getting me? So now, back to your question. What causes it? Poor diet is one of it. When you take food that are, when you acclimatize yourself to diet high in fat, high in calories, that is energy, and when you are not eating an adequate diet too, can cause it. Lifestyle also can cause it. By the time you take alcohol, you just live your life anyhow. You take beer and all that, many other things. And also, it can be hereditary that may cause yours. And if anyone has it, it may be hereditary. It can either inherit this from the father's side or from the mother's side, unknowingly, through the gene. Are you getting me? And once you know in your family that this particular health issue is rampant there, you must take note and you must take care of yourself well. They said ignorance is a disease on its own. Ignorance. So please, Let's take note of that. Also, hormonal changes too can predispose one to such health issues. Are you getting me? And more so, if diabetes is on ground and it is not well managed, we and as a dietitian, doctors, nurses, we have role. Even physiotherapists, we have role. We used to work together. It's always an multidisciplinary health issues, and which we used to work together to do that. So, and if you eat food that is not so rich in fiber, if you are the type that just eat junks all the time, you don't eat food that are rich in fiber, dietary fiber, okay? You may likely, come up with such.
Big grammars. It's you that you understand. Please, all these dietary fibers, all these, break it down, sir.
Okay. Let me break it down a bit. I have to talk like a professional. Of course. I believe we are all students. Most of us here, we are students. So we should be able to understand. And that is why I'm speaking that way. Well, in Yoruba, we call it amunokun. Okay? That is the shaft, roughages that are in our diet. It helps us a lot, but many times we used to discard them. In our grains, our cereals, they are embedded in those kind of food. Our millet, our guinea corn, sorghum, even oats, we used to neglect them. To the essence that even some of us may say, we take pap and all that. And do you know pap? Once it passed through fermentation, the probiotic effect is already there, which help your gut health and also help to balance the overall, your overall health as well. So some of these things we used to think that I am not animal. It is for animals. So I'm not animal. So why will I be eating shaft with this thing? No, it should be removed. No. It is always good. You put it in there. Yes. Are you getting me?
That's what he's saying.
I will tell you some secret of food you don't know today. So just stay calm. All right? Because I could see that we are eager to hear what I want to say. So please, you may not see it. It is called fiber pap. Okay? Fiber pap. You may not need to sieve it. Just grind it well. Grind it well. Are you getting me? Or if it is small child that want to partake in it, you may sieve their own. Why? Because the enzymes that help in proper digestion of this fiber may not have been present in them at that moment. So they don't need high fiber. So some of you that used to think, golden more is to be given to a child. So you are automatically causing trouble for that child. Some of us, we used to give golden more at tender age. We think, even it is written there. That's one mistake we used to make. We don't used to read nutrition label. Nutrition label. Someone like me, expert like me, or food scientist must have worked on that kind of food package and all that. But it's good for you. It's good for you. You just buy. And so I just pray that we will not use our money to buy what will kill us. And in the advanced country, they will even write it there. They will write it there. This person is to take this. This person not to take this. It's not good for someone like who have diabetes, someone like who has hypertension. But here in Nigeria, we just produce food anyhow. And so there are a lot of things that that do cause that. Please.
All right, please let's celebrate him. Mama, you mentioned mental health the other time as something that is prevalent currently, and I agree with you. So what can we do concerning this mental health? How can we go about it?
For mental health, I think the first thing is to take life one day at a time. Challenges will come, and in fact, it's part of life So just take it as if today I have 24 hours. I want to go to work. Just follow that routine. Not as if you want to, within 24 hours, you want to spend 48 hours for things you should use 24 hours for. Then apart from that, we need rest. And at least 6 to 7 hours of rest during the night. That means we have to sleep at least 7 hours so that we can be refreshed to go further the following day. Then apart from that too, I would say social media is good, but the news these days can even give one mental health issues. Like there are some issues you have to just screen. Like not everything you listen to, not all news you listen to. I remember I think it was last year of a thing that they announced the issue of fuel subsidy removed. And then people started running from one angle to the other, buying petrol, buy this, buy that, so as if it's not going to end like that. In the course of that, we have people, I think there's a news recently where somebody in the filling station lost his life, slumped inside in the course of getting petrol. So we have to screen some news and then do it as if we are all in the system. We are all together in it. Then apart from that too, we for mental health to improve on it, we also need professional help too. I think there are better awareness now because I see people posting, they want to see a therapist, they want to see this. And that is when you start feeling some things in yourself, like you start withdrawing from people. You are not happy throughout the day. Then maybe you don't want to relate, not taking care of oneself. You see some people, they don't, at a particular stage, it's as if they lose interest in everything. They don't want to take care of themselves again. Then those ones are keys, little sign that you are bringing in mental illness to yourself. Then it's better you speak up. You talk to professionals. And then thank God for our churches where we have fellowships together, where we relate together. I come here now. I'm sure nobody can come here now and start crying. Because sometimes even from the song you sang, that we should not cry again. So, even those ones could bring smile to you because you really related with people, and then that will even change your mood. So, apart from that too, we can also learn to read books not books that brings in danger, books that can help us, like books that can help us on how we can relate with people. Then sometimes there is this workplace issues that we used to have that leads to mental illness, that affect our mental health now. And then you can speak to your supervisors. You can speak to them, speak to colleagues. Then there is an aspect of family relationship too. We cannot just ignore our family members because we are the only one passing through some stress. We have to still relate with family. And sometimes when there is a large burden on us, sometimes they used to say, I think there's an adage that says 2 heads are better than one, but I would say 2 good heads sometimes are better than one. So sometimes when you share ideas with people, you can from there get other things.
One thing I want to beg is, normally when we come to church, we bring out our jotters and write. It's not only when pastor is preaching. Please bring out your jotters and write. They are sharing powerful tips that you will go and pay for. Please, I hope we are following everything they are saying. All right, please, let's celebrate them again. Please, do we have any questions? Please let it come before I go to sir. Okay, no, so I'm very glad that you specialize in a way with the pregnant women. To us is a plus for us. And I would like to ask this question. So recently, I've been seeing cases of when pregnant woman, you mentioned case of preterm, giving birth before time, I know that. But this case of when you give birth to a child, tongue tie, there is tongue tie. In fact, it's now so much now that I began to, so you now have that fear that, if I give birth now, she could need tongue tie. It's common. And a lot of things are now happening, which I know that before it was not really like that. What can actually be the cause? What precautions should pregnant women, what are the things they should do? And, I'm asking this question, not just for pregnant women, because in DIC, all our what? married, all are fruitful. So you need to know these things in advance. I know a lot of weddings will still come up next year. Yeah, so you need to start noting these things now. It's not until that time. All right, so, sir.
All right, praise the Lord. I will not just narrow it to, you gave an example of tongue tie. Okay, so, because that one in itself, it's some other explanations regarding that, but let me use the word congenital anomalies. That's when a baby is born with some defects or deformities. There are many. You see some with polydactyly, syndactyly, meaning their fingers can be fused, some with extra finger, and so many other things. So let me warn pregnant women. Pregnancy is the period between conception and birth. It's divided into 3 trimesters: first, second, and third trimester. The first trimester is the most critical period of any pregnancy. Why? It's the period of organogenesis. What do you mean by organogenesis? That's when the organs are forming, the various organs in the body that will eventually become systems, okay? They start forming between the first 12 weeks of pregnancy. Now, exposure to any chemical substance, exposure to any agent that can alter the genetic sequence, because every organ formed is following a coding. I think some of us here are tech experts. Coding. Once you alter a code, the outcome will be different, isn't it? The same thing, any organ that is forming, once you alter the genetic code, a different or a malformed organ is what you are going to get. So chemical agents like pesticides, insecticides, the kind of food you eat, if it contains excess preservatives, okay, medicines that were not prescribed, because that's why once a woman is pregnant, I don't treat. I will ask you to go to the hospital. You know why? So that every treatment you had in the course of your pregnancy is documented. That history may be relevant when you deliver. It may be relevant even at the point of delivery. So, every pregnant woman should be advised that your first 12 weeks of pregnancy, even if, for example, the usual sickness that comes with pregnancy, early pregnancy symptoms like maybe excess vomiting, which we call hyperemesis gravidarum. You can have excess salivation. You can even come down with malaria easily because, pregnancy is overwhelming on your system. It can weaken your immunity to some extent. So you can easily come down with any disease that has been lying latent in your system before you became pregnant. All right. So I will advise that woman, go to a hospital for treatment. Not because you cannot get the best treatment from nearby shops, chemists, not chemists per se, pharmacists or medical colleagues around, but just because of documentation purpose, for historical purpose, okay? That's one. Then 2, I want to emphasize that what you are exposed to, you can inhale, you can swallow. These are various routes that chemicals can enter the system, or poisonous agent can enter the system. Listen, anything flowing in the blood of a pregnant woman eventually gets to the baby, directly or indirectly. Okay? So we must be careful what we take in, so that the outcome, that's the baby you will give birth to, will not have some defects. And some of us will say spiritual attack. No. Some of them, we are out of ignorance. So please, let's be warned, okay? Then let me try to talk a little about the issue of tongue tie. In my practice, in my training, okay, emphasis was not placed on tongue tie. Perhaps then it was not an issue. Besides, I trained outside Nigeria. And when you mentioned, they never one day cited a case of tongue tie. But coming down to Nigeria, my country, in my first O&G posting, my first pediatric posting, I was hearing tongue tie. What tied the tongue? So, I was not told that, no, in this place, we will sweep the tongue. There is what they call frenulum of the tongue, okay? That sometimes it will become either longer or it will hold the tongue down, that you need to cut it so that the tongue will be free. All right? In some cases, it happens. But in some cases, some mothers hearing from other women that, this is your baby that is not crying loud, it can be tongue-tied. And out of that, they will go to meet somebody that will help them to what? Untie the tongue. In some cases, the tongue is not actually tied. A crying okay, I will now ask some of them that, but your baby has been crying. Did you hear or you did not hear? I heard. So why is it that after 3 months, you feel your baby have tongue tied? So some of them is just out of maybe ignorance and fear. So before any tongue is untied, please let a doctor or a nurse verify that the tongue is tied. Thank you.
All right. Can we celebrate him? All right. So I have so many questions here. I was trying to sieve them, but unfortunately I could not. So I will just ask. So, sir, what is the cause of fibroid in women and how can it be prevented?
All right. Fibroid. Fibroid, let me use very simple language so that the message will be passed across. The etiology of fibroid is unknown. What do I mean by etiology? What actually leads to fibroid is what? However, there are many risk factors. If you pinpoint that this is the specific thing that causes fibroid, it's not actually established scientifically. However, there are risk factors. One risk factor is hereditary. If your mother or in their lineage there is history of fibroid, it increases the risk. I didn't say it means you will have. I said it does what? Increases the risk that you can have it. However, as a man in Christ, we don't expect the bad genes to be transmitted from our lineage into us. Why? Because the blood of Jesus acts as a barrier during our salvation birth, isn't it? So it purifies and separates us from anything that is not of God. However, bear in mind, as a medical person, I will tell you that a person with a history of fibroid, you are at risk. That is one. Then two, bearing in mind that fibroid tissues are abnormal growing cells in the womb of a woman. Let me use womb, but scientifically we call it uterus. The name fibroid or fibromyoma is because your uterus, the scientific name is myometrium. So myoma means an abnormal growing tissue in the uterus. So oma means it's benign. It will not spread beyond the uterus. However, fibroid can predispose to cancer. I didn't say it's automatically cause. I say it can predispose. So, chemical carcinogenic agents that can make cells grow abnormally. The truth is, what we eat these days, whether drink, whether food, has undergone a lot of genetic modification. I'm sure our dietitian will talk more about it. A lot of genetic modification. Everything can be gotten fast now. All these things. Your womb is one of, if you know the work God did on a woman's womb, it's unbelievable. Can you believe a pregnant woman, her womb will expand when she's pregnant, can even carry twins, can carry triplets, and after delivery, it will still shrink and descend back to your pelvic region as if nothing happened. To tell you that the cells of your womb, they are cells that can easily undergo changes. And the fact that they can easily be programmed for changes can easily make abnormal cells to do what? Multiply. In fact, yesterday I saw fibroid, a very big one, about 9 centimeter by 7 centimeter, in a 21-year-old lady. When I scanned, yes. Now, let me shock you. Fibroid can occur from your teenage, when you start menstruating, till your, in fact, from when you start menstruating till, I don't have an end for that, you can have fibroid. Because from menstruation, your womb is already undergoing changes. Okay? It's all right. These are just some of the few things that can cause it, apart from any other, maybe if the person had previous history of maybe some, let me not go deep into some medical thing, but just remember that hereditary, carcinogenic agents, toxic carcinogens and other things can predispose and alter the rate of multiplication of the uterine cells that will eventually give birth to fibroid.
All right, thank you so much, sir. You see, honestly, the questions here, I'm like, God, help us. So I don't know if the panelists can help us to just try to, while touching the major aspect. Okay, so this question, I find it very interesting. The person will know why. So he said, please, I find it difficult to drink water regularly. I can eat in the morning and not take any water till night. Ha. What can I do to help improve my water intake? Okay, please answer that first.
Okay. Water does a lot of work in our body system. It helps to prevent you from dehydration. It helps you to it prevents you from migraine, you having headache. And sometimes you may think, oh, it is probably the way I've used myself and all that. If you don't drink water well, adequately, you may come up having such kind of a thing. While reading, it is essential you drink water because the brain too needs it. So to improve that, but to help you in that issue now, the person that has that question, please always try as much as possible. You need water, at least 8 glasses of water. 8 glasses of water per day. You should take it. When you either you finish eating, few minutes you have to eat water, and during your leisure time you are moving all around too, you still need water. And why? Because there are some, doctor have just made mention of carcinogenic properties that are in our food and all that. So that some of these toxins that comes with our food naturally, okay, can be flushed out so that you will not have all these issues, health issues that we are talking about here. It will help you. Please, when you go to toilet to ease yourself and you are observing your urine is becoming yellow, brown, something is wrong inside. So you have not been drinking water well. And for your kidney to function well, you need water. That is the area where filtration is taking place. And if you don't filter all these waste products that stores in our system, if you don't filter them well, we'll write letter to health issues that we don't pray for. Please.
Yes, sir. Thank you. Still on you. What are the possible causes of low sugar level? And what are the possible solutions?
Low sugar level. Well, it may be as a cause of, if one is said to have a low sugar or high sugar, it's still called diabetes. Are you getting? So it's still diabetes. But the cause, it may be as a result, you overuse the energy that is already stored inside you. And if you don't eat food that are rich in energy too, that's carbohydrates kind of food that can help you to sustain your energy level, you may come up with that. And you may come up with a low sugar level. And if you are the type that is, very common, your blood sugar level is not at the normal range that's supposed to be, it's always very low. Okay, just for example, 3 millimole per liter. If it is tested with the use of glucometer, and it's always often like that, it is not a good sign. You have to build it. You have to make sure it is on the normal level side. Are you getting? And what can you do? Always try as much as possible to visit the hospital for check-up, to know. I said it the other time, if you come to the hospital, someone like myself will be involved. in one way or the other, because diet plays a larger role in the issue of management of diabetes and its complication. So please, and such person, if it is all the time it used to happen, what do you do first? So now my knowledge as a first aider now comes in now. You can take these soft drinks. It is called energy drinks. Abi, our Coke, 7-Up, okay, for quick replacement of the sugar that may be losing. Because when one enter hypoglycemia, it is very dangerous. One can go with that immediately. So please, if that used to occur time to time, that is on the low side, that is the way your sugar used to be, please always try as much as possible. Either you go with, a bottle of Coke, let this always be close by, or sugar, either cubes, always go with you. Are you getting me? In case it happen, you quickly put it in your mouth and add water, okay, so that or tell someone around you. That is why we need ourselves, okay. This is what I used to face. Please, if that's happened, you may not know when it will come, and you just discover that you are getting weaker, you can't really talk, and before you know, someone may snore and fall down. So,
all right, thank you, sir. I'm still coming to you, but Ma, someone said, often at times I notice that at some points mentally I find myself unstable, even with having rest and all of that, and it happens for some couple of days, and afterwards I get sick. What can be done to avoid this?
Like I talked about, you still need professional help. You can't do it alone. There are drugs that they prescribe you. Although as psychologists, we don't prescribe drugs, but psychiatrists prescribe drugs. Sometimes when you tell people to go to psychiatric hospital, they still that, I'm not mad, it's not basically because somebody is mad. That is when it's going to psychiatric. So there are drugs that could even help to increase your mood. And I think to some extent, I'm also coming to places like going for events too, would also help.
Okay, sorry. Thank you, Ma. You see, there are a lot of questions there. I'm trying to just place them out. But I also want to ask this question too. Okay, I think I will ask our nutrition this question. He said, my question is, as human, to live elderly, what are the basic parameters we can use to checkmate our health, even as workers, to know when we're already sick unknowingly, and what is the solution? I think even our doctor will attend to this. But I want to say and read a lot of questions together so that we can all say it together. Okay, so this person also said, one of the panelists mentioned how that people have peptic ulcer without knowing it. Is it bad? How does the person get to know? Are there any signs of unnoticed peptic ulcer? Also, what causes ulcer? Is it lack of eating or what?
Well, let me start from there. There are a lot of factors that predispose people to ulcer. Okay? And I've said it the other time, poor eating habits. When you eat, you eat late, stress also can even cause it. Some people, they are not on spiritual assignment or, like fasting. They won't eat early enough. They will use their breakfast, turn it to a lunch time when they're supposed to have eaten breakfast. The whites that will follow, the reason to say when by 12 midnight, okay, you have started fasting. So early in the morning, you are expected to break the fast, and that is why they call it breakfast. Okay, so but walk. We want to just make it that we get to work on time and all that, we will not hit. These are predisposed factor that used to cause it with time. When you are addicted to such, you don't eat breakfast. You always turn it to night. And more so, another predisposing factor that used to predispose people to that is eating food that is not well cooked, like some fast food that we eat or time to time, like that can predispose ones to it. Our doctor just make mention of some agents that may be inside some of these, even can lead to cancer. Also, it's also part of it. When you are not eating well, when we feed on junks, can lead to that. And more so, water, unclean water, food that is not also well cooked can also predispose one to coming up with ulcer. So please, we have to be careful. And the food we may not know, or the water we may not know that it has Helicobacter pylori, which is one of the microorganisms that causes this when we embed it into our system. So, and I said it the other time, ulcer can be any part of the body. It can be the duodenum ulcer, jejunum ulcer. It can be the peptic ulcer. It can even be the gastric juice ulcer. So there are a lot of things that may be involved in that health issue. So what we eat, let's ensure it is well done, well cooked, and let's try as much as possible to environmental hygiene, food hygiene, personal hygiene, all those things too. They are factors that we need to put in place to get rid of all these things that we are seeing.
Okay, sir. Also, in this economy, thank God it's blessed. How can we eat healthily without spending too much?
Oh, there are a lot of ways we can eat healthy without spending too much. Well, one of it is that we should try as much as possible to eat that there are some organic food around us, locally available food. We should try as much as possible to always, lay our hands on that. And even we can go into little agriculture as well. If we have a small piece of land and we can cultivate, plants, vegetable, and always readily available around us anytime we need it. Even pepper, we can do all this to help us better. And let's limit processed food, because this is one of the contributing factors that predispose us to different health issues. Let's always try to do our food locally. This also go a long way to help us to live healthy.
Thank you very much, sir. Please, let's celebrate him. All right, our doctor, we have a lot of questions of pregnancy, child and all. But let me start with cancer is common these days. This is from, because our other branches are also connected. So this is from our other branch. Cancer is common these days. What is the causes and how can one prevent it? Then diabetes and blood pressure, are they related?
All right, let me start with the cancer question. The truth is, I'm not trying to scare also, but cancer is really becoming more common. I think every week we come across cases of cancer of the breast, cervical cancer, or at least we must see one malignancy every week. And before, it was not this common. But there's this, like I said, I'm into radiology to some extent, where you just see, before we used to think cancer is a disease of elderly people. But now, we are seeing them in the 30s. Young people already having cancer. That is to tell you that a lot of things are wrong with our environment right now. The air we breathe, the food we eat, a lot of modification is either still taking place or has completed this process, and is not, the effect is now in the human body or whoever is consuming it. So we need to watch out. Okay? Now, of course, we know that there is no specific cause of cancer other than an agent programs the body cells to start multiplying abnormally. And they are more prevalent in tissues where cellular growth can be very fast. Like in women, talk about the breast, talk about the womb, that's your uterus, your cervix, and other areas where we have rapid growth of cells. So what we can do in our own little way is, see, some of you work in organizations where medical checkup annually is free of charge, but you don't take advantage of it. Some of you are privileged to have access to regular medical checkup, but you don't do. Sometimes I understand the fear that let them not go and see something, or let them not go and give me one evil medical report that is not my portion. Do you understand? But I think that the earlier you discover some things and start working on it, the better. You see, preventive maintenance is cheaper than corrective maintenance. It's cheaper to prevent, just like a dietitian said. It's better to eat balanced diet than to try to correct nutritional diseases or malnutrition, as we say. Do you understand? So, because of time, let me quickly dive into diabetes and hypertension. We discovered this. The truth is, if you are hypertensive, you are at risk of having diabetes. And vice versa. If you are diabetic, you have the high risk of becoming hypertensive. That's why once a person starts having symptoms of high blood pressure, immediately we will recommend that they should go for sugar check. Because once your blood is already hyper, so there are chances that the organ, that's the part of your body that controls your sugar, may also want to go hyper. And as a result, excess sugar will be released into your blood and you become diabetic. So, sometimes, yes, you can have them coexisting together, but it's not always the case. Yes.
Thank you very much, sir. All right, so let's give the mic to Mrs. Olaniyo. The person says, I have discovered that my sleep pattern is affected by a probably wrong sleep schedule I kept during my undergraduate days. I sleep, but I don't usually sleep for longer at a stretch. My sleep is sometimes broken down into at least 2 weeks a night, and sometimes my whole sleep time doesn't exceed 5 hours. Also, I have noticed that I talk and act scared and stressed during sleep, although I have no memory of the events. What can I do?
For that question, I would say the first thing is, when you want to sleep, put away your phone. Sometimes if we observe something, like if you wake up at night, suddenly, and then you pick your phone, maybe you just checked, you might not want to sleep back. And then you have started distorting the sleep pattern. Apart from that, as psychologists, we have something called relaxation techniques. And this is what you do. When you want to sleep, you remember sweet events. You close your eyes. You lie down. You remember sweet events, things that bring sweet memories to you. It might not have happened now. Maybe you want to japa, you see yourself in the aeroplane. So you see yourself in the aeroplane, the way you want to go. So from there, you see maybe you are landing in another place. You just figure, you are already asleep. You just figure it out. In fact, your sleep will be sweet. Your dreams will be sweet. But when you start thinking about, I just bought rice, 2,700, 2 this, 5,000, and then you want to sleep. Before you sleep, then you start dreaming about even sometimes you can dream about Nigeria, that the world wants to collapse. The hell fire is there already because of what you have imagined before that. That's another thing you can do. So for relaxation techniques, you can browse about how to do it, although there are practical aspects of it too, because it's a technique in psychology that we use. And apart from that, what I don't advise is inducing sleep through drugs. Because sometimes your body system gets used to it, and then if you don't take that drug, because you're already addicted to it now, you start developing other illness in the course of it. I remember a case of somebody who take all these small pills. From there, it generated to other. So if he doesn't see that drug, he will not sleep. So from there now, you start using drug to sleep. It leads to other illness. So for me, I don't know of doctors, but for me, I don't usually advise taking drugs. I prefer, and then sometimes eating healthy food too. Good food is not when you want to sleep, you now swallow heavy food there, but that is so mighty. And then in the course of that, you will be so heavy. to even wake up to sleep. So I think we can also work on that.
Yeah, thank you, ma. Someone has it's already been answered, so I won't ask it. It was like, what's the advice on improving mental health? I think you're already there with that. But I want to ask a question. I want you to talk on the link with depression and suicide. Because I remember when I served at the clinical psychologist department there, Dr. Tomoloju do say that for cases of suicide that maybe they didn't eventually die, they were rescued. One of the things she do tell the patient is that if you can attempt to kill yourself, then you can kill anyone around you. All right, so it's not just about you now. For you to attempt to kill yourself, that means anyone around you is not safe. And what we have discovered over time from those suicide survivors, if I can say that, is that it's not like they really wanted to do the suicide. Some of them say they just want to do it for people around to know that they love them. They just feel, and eventually they will end up dying. So meaning most of the people that even died, they wish they did not die. They wish someone came on time to their rescue. But this is where I'm going. Most cases is as a result of depression. You ask them, why did you kill? I'm not happy. My parent did this. My parent did that. So how do you combat depression so that it won't lead to suicide? That's the question.
Yeah. The question now, let me answer it like this is, just believe your past is past and that you are living in the present. For instance, what you have passed through when you are still young, maybe your parents did not take care of you, you sponsor yourself to school, you did everything by yourself. I am alone, I don't have relations to talk to, I lost my parents when I was still young. All those ones, so far you are alive, you are a whole, like you are still living. Just believe there's a future and just believe that there is still what God wants to bring out from you. Now, when you start thinking about, like I said the other time, depression, the first thing is low mood. You start, and sometimes they have this low tone. When you talk to them, the way they reply, their tone they are always sad. Now, when it start coming like that, like there are people to talk to. Although for suicide now, the peak to get to for suicide, I think, is when you don't have anybody to talk to again. And sometimes people also ignore the signs. Somebody is telling you that he has not eaten for 2 days, and then you are preaching salvation to the person. Or maybe somebody is telling you, like maybe in an organization now, like let me say use because of the setting we are now, this is a church. There is something called the welfare or something. But now somebody comes to you like, Pastor or sir, I've not taken anything, I've not doing this, and then you now open Psalms for the person to start reading. Instead of, I think the first thing is maybe eat this, do this, and then from okay, let's throw out, let's go to gatherings. From there, the person might even tell you that, sir, even from what happened now, I just thought of suicide. And then from there, you already picked suicide. Then you can help the person. But a situation where people just live and they will live this careless attitude, like we don't care about people like before. Maybe because we too are overwhelmed by our own challenges. But sometimes we still have to keep in mind that we should keep our neighbors. When we don't see people, we should call them. I've not seen you for days. Those ones too. So that to avoid issue of suicide. Like I think there was this instance of somebody who said because the president increased the fuel, or so he wanted to commit suicide and went to climb on the mask. I think recently it was on the news. And then you imagine if he now killed himself, will Nigeria petrol price drop? So I think sometimes you are not trying to impress anyone if you kill yourself, and then you even go to hell. So you are not trying to impress anyone from that. But what you are trying to do is you are trying to terminate your own life at the excess of your loved ones. Because sometimes it's painful, and then the news carrying that your family member commits suicide is crazy. But what I know is this, that we should always keep ourselves. When we don't see our friends, we should ask about it.
Thank you very much. Please, let's celebrate her. All right, so I want to take questions from online. We have so many people watching online, so many people. So the person said, how often should checkup be done? Always. How often should checkup be done?
Okay, so depending on your age, I think up to 30 years, okay, you can. What I generally recommend is irrespective of age, at least once a year, do general medical checkup.
Okay.
We are privileged that some students, some universities, police, or whatever institute of learning, before every session starts, you must do medical checkup. Well, I don't know of Nigeria, but where I train, every year, whether you are a lecturer, you are a student, as much as you are working in that school, you must do annual medical checkup. They will check everything. So I recommend the same thing.
Okay.
Yeah.
Annual. All right. So is there a cure for rheumatic pain?
How did the person know it's rheumatic pain? Because what we call rheumatism, people don't really understand what is rheumatism. And I pray they don't even have what is the real rheumatism. So sometimes what they call rheumatic pain is just simple arthritic pain. And of course, you can only manage arthritic pain because it depends on what is causing it. Some arthritis have to be managed for life, depending on what is causing it. If it is rheumatic, it's a different thing entirely. So I advocate just conservative management by regular consultation with an orthopedic doctor. Yeah.
All right, so thank you. What can be the cause of peppery feeling in the anus?
So many things can cause it. Your diet can cause it. What you eat, then some illness. Sometimes there's what we call hemorrhoids or pile. If any of those hemorrhoids or pile become ruptured, they can cause pain. Sometimes you can have abscess in that region. So many things can cause it. In fact, that is proctology. It's a specialty in medicine alone. Study of disease in the anal region. Proctor is a specialty on its own.
Okay, God will help us. So this question, I find it so difficult to take proteins like egg, meat, and also drinks like Coke and the likes. I can't even eat egg boiled by myself. Do you think I'm healthy?
Well, that person, he or she may be allergic to it. Because some people, food is another poison to some people. It is poison to some people. So some may be allergic to milk. I've seen patients that told me, please, sir, never in my life, I've never tasted milk in my life. Milk. That is so sweet. I have never tasted it. Why? He's allergic to it. If he takes it, it's another thing that will come. So that is just it. But our food must be adequate to have a balanced life, to enrich our soul, our body, and our spirit. The three, we are tripartite being, okay? So we are made up of the three. The three one must not leave the other. They are interconnected. Please, praise the Lord.
Hallelujah. So I think the last question from online, before I pick some, then we'll round up. Okay, please, I may not be able to take all the questions. I apologize. Otherwise, we'll sleep here today. You know that. So person says, I've always known that what causes ulcer is bacteria, Helicobacter bacteria. What is the correlation between not eating well and this bacteria and cause of ulcer? I have seen people that eat well, yet have ulcer.
Well, the correlation is this, that if you take food that is not, all these are convenient food, geisha, Titus, and all that. When you are the type that eat it without cooking, and you take water that is not well treated, are you getting me? Or water that's already expired. All these are water has expiring dates. Without knowing, you may invert this and enters your system, and with time, and it can be causing health issues. And also, when you take all these are raw food,
that's a whole pint of blood. So how much more routine hematinitis that will just be adding droplets every day? So you need minimum 2-3 months to boost your blood level. So weakness could be as a result of low blood level. So the person should check to check her PC. And again, BP. What is the person's blood pressure? Some women come to throughout antenatal, their blood pressure is 90-60. It's on the lowest border level. After delivery, what will happen to that same woman? Perhaps it's even less than 90, which is critical. So let's check the PCV, let's check the blood pressure because of our time.
All right, thank you, sir. I want to ask if it is normal for a lady to have extreme menstrual pain once in a while, pain that you feel you might pass out, vomiting, diarrhea. The extreme pain is just like once in 3 months.
Actually, you've not seen, you need to see some women, menstruation is like hair. And I do feel for them. But what we should understand that there is a cause. You need to find out. Now, there was a friend of mine that kept having this issue until she did scan and discovered that it was just simple endometriosis, which we now use drug to correct. So, for every menstrual pain, something caused it. You need to find out. Is it a hormonal imbalance? Is it ongoing uterine pathology? Could even be fibroid. It could be adenomyosis. It could be endometriosis, like I said, so many causes. So try to rule out what is causing it so that you not just be seeing it like a cross I have to endure every month. No. There could be solution. Even contraceptive, because sometimes when you see contraceptive by mistake in a person's bag or maybe by chance, you just say, she's not married and she's using contraceptive. You begin to think, maybe she's playing something somewhere. No. Contraceptives are used to correct hormonal imbalance and even menstrual irregularities. So I'm not trying to exonerate any woman you see with contraceptive. All I'm saying is that from my own medical point of view, it's not only used to control birth, it can also be used to control menstrual irregularities, especially those daily pills. We can prescribe them for that purpose. So anybody facing menstrual cramp, go and check. Perhaps there is an ongoing uterine pathology or hormonal imbalance that is causing it. And it can be corrected. You don't have to suffer every month for that.
Okay, sir. How can an HB person manage herself during pregnancy?
What is that?
HBSS.
That's sickle or H.
Person shall write
that's most likely sickle cell. Yes, okay. Sickle cell. First of all, for a sickle cell to be alive, to get pregnant, that is already a big testimony. Now, to manage the pregnancy till delivery is already the person has already tried. However, childbirth for a sickle cell patient must be under supervision of not only the obstetrician and gynecologist, but the medical team, talking about the internal medical specialists must be involved, hematologists must be involved, pathologists must be involved. It must be a holistic care because a sickle cell is already at risk. Okay? However, we have had cases where they deliver and no issue. But we have also had cases where they had issues. Okay? So, is that from onset of your delivery, your antenatal visits must be regular. And don't just go, you have sickle cell, don't just go and register in a primary health center. Go to a teaching hospital or a general hospital that have specialists in every field, including your field as a sickle cell patient, so that your care will be holistic. Because throughout the pregnancy, you may just be in and out of hospital every month. To avoid that, ensure you book at a tertiary care center, meaning not primary care center.
Thank you very much. Please, let's celebrate him once again. Okay, so this is going to be the last round, but I will ask a question, then you had any other thing you wish to let us know. All right, so I want to ask just help us tell people the dangerous effects of eating every time canned thing. You get what I mean by just canned products, corned beef, this one, you are feeling cool, I had imported things, and I can't. Another thing again is this balance of taking, like the sub you mentioned. I know that someone low in blood sugar, they quickly want them to take coke and all. And also help me balance it for them. That does not mean that you will take 10 crates of coke and all of that. So the balance of, and also help us talk about how you need to just make sure you eat balanced diet in a simple way that you can afford. Someone even requested for a diet plan. I said, maybe I'll come to you personally. You now send it to me, I'll now send it to them. All right, so let's have you, sir.
No problem. Well, on that noted, but I must know the medical. I must know the medical history of that person and what he or she is facing, so that to know, and also know the likes and dislikes, what he eats and all that. So we'll talk about that later. Well, to eat a balanced diet. Let me use an illustration. We want to eat rice. We are able to afford rice, and we bought it from the market. Instead of you using ordinary stew, you can add vegetable if you can afford it. Are you getting me? Because it goes a long way to help you to gather some nutrients like minerals, vitamins, and all that. And when I talk of those nutrients, they are complex, they are many. So, and more so, you can add your fruit. Your fruit can be in between. Are you getting? Either orange, watermelon, cucumber, are you getting me? Or pawpaw and all that too. They are excellent source of vitamin C, naturally available in them. Okay? Chemically refers to as ascorbic acid, citric acid, and many others. So that is on that. And more so, your fish or meat can go with it. You know, it's a source of protein. If you cannot afford fish, you may be able to afford meat a little, or even maybe crayfish that you even have to spice it. If you cannot afford fish, you cannot afford meat. You may, and more so, it may be egg you are able to afford. One can go with it. Not that we just look them together, because some of us, when we want to eat, and Bible is against glutinous eating, according to Proverbs. All right, let me not take us to the Bible, because all what we are saying is inside the Bible, is there in the Bible. So the pattern God wants us to live is inside. So let me not go into that one. We have been taught, and I think the beginning of the service, a lot of scriptures has been reading to us. So this is the way we can eat and have an adequate diet. Your water too should go alongside with it, because it is it's a medium through, the work the water will do is this. It will help to carry out, to help in proper digestion, absorption of that nutrient into the body, and also, serve as a vehicle to carry those nutrients of which you have eaten in that bowl of rice, that plate of rice you have just eaten. It will help to carry them to necessary areas or corners that the body needs those nutrients to perform their physiology and functions and all that. So that is on that. And to the person who said, okay, that has a question of diabetes the other time, and I talked about taking Coke. Not that you will take it, you take it too much. Before meal, the main meal that you're supposed to eat, before it is ready, that is when you take that. Are you getting me? Before. So you can take half of the bottle, not all. Are you getting me? Half of the bottle, just to boost up your blood, your blood sugar. Don't take it in excess. And some of us, we form the habit of, even when we take rice, we have to take soft drink along with it. Even when we eat this, we have to no. If it doesn't, no, I can't take it. It has to go with something and all that. And more so, doctor has talked about the issue of pregnancy and all that. During that time too, some people, that's when they will start eating anything comes, anything, anyhow, and all that. And that pregnant woman can write letter to all other health issues like hypertension, gestational hypertension predisposed during, induced during pregnancy can come in. And when you take too much sodium, that is salt, our salt, okay? They are common salt. That's sodium chloride. There's a chemical in it. But when you take it too much too, can, contribute to, developing hypertension. So please, let's try as much as possible to limit the intake of all this processed and canned food. Are we getting me? To have a better health. Because there are a lot of things there. They will surely add salt to it, to preserve it, to elongate the shelf life of that food product. And when you are the type, all these things are what we eat. Even sometimes we won't have time to cook. We'll say, oh, please order from so. We'll order it and they'll bring it. And it's smelling nice. Oh, wow, that's good. They want to make money to their purse. They are not after your health. I'll tell you the truth, okay? So it's to make money to their purse, but your health is another thing to them. So please, let's cook the food by ourselves. Let's try as much as possible. The one you can afford, let's cook it. And the issue of diet, it goes a long way to help us to prevent all the disease we have cited, and we have, my own area of specialization is in the preventive side. We coach people as well. Lifestyle changes. Some, it is their lifestyle that predispose them to what they are facing. They would, refer them to us. Doctors, they will refer them to us. Please go and meet the expert. And when they now do what we ask them to do strictly, when they obey, and I give another appointment 2 weeks' time, come back and let's check. And they will just see that, wow, dietitian, is there anything magic you put inside what you told me to eat? And no, that's the science behind what we eat. And as you have followed strictly, you have a better health. A mother will come, will tell me, please, dietitian, I can't lift my leg. I just observed that I am weak. And when I come to the hospital, it's always bike man that will bring me to the hospital, and I can't really walk like that. When we even ask the patient, okay, climb on the weighing scale, he couldn't climb. We were the one that assisted her to climb. Why? He's obese, and more so, he's having excess energy in our system. And doctors has already seen that. The family medicine doctor has already seen that, and they said they refer her to us. And before we now, I give some therapy, okay, do this, do that, do this. Because weight gain is very easier, but weight loss is not always easier. So let's be careful. Weight is always not easier. 1 month time, she came back. She said she's not seeing results. He's saying, wow, I'm not reducing in weight now. Why? What? See, madam, it will take time. Okay, so just go back and follow it up strictly the way I've said. And it went away again. The second month, when she came back, she's like, wow. And I asked her to climb the scale. Exercise is also part of the regiment and all that. And so there are many things that is involved that I asked her to do. So when he now came and climbed the weighing scale again, I checked wow, madam, you have reduced 1 kg. You say, wow, since all this time, and you said I should not eat this that I love to eat before. I should not eat this, I should not eat that. And to the glory of God, later she now came back, and within 3-5 months and all that, she get better. She says, see, sir, I can lift my leg now. Everything has it's like some things are there before. I have burned them out, and she's fine. And to the essence that she used to take bike into the hospital before, bring her into the hospital. Now she did something. She said, "See, sir, I did something. Now let me explain to you." She said. He asked the bike man, drop me at the gate. I want to walk with my leg into this place because I am feeling better. So, this is our diet, when we eat well, adequately, balanced, as we all know, please, it goes a long way to help us manage our mental health. It will help the productivity of what we'll keep doing. And also, it will prevent us from having any chronic health condition. Thank you.
Please, can we celebrate him? All right, so Ma, over to you. So personally, I believe that if you are okay psychologically, most of your problems are solved. All right, so I just want to speak to us on that, and then final words too.
My final words is know your priority. Get them right. You can't do everything at a time. Know that you only have 24 hours in a day. And out of that 24 hours, you have to sleep. And then when you see some signals like you are not feeling fine, not until when you are down that you go for checkups. You should go for checkups. You speak to professionals. And also try to get things easily. Like try to run after things. Take it easy. We all want to become billionaires, like money, especially present youth now. But believe that there is the time for everything and there is a process for everything so that you don't jump from up down when you are still down.
Wow. Powerful. Thank you, Ma. All right, sir.
All right. I'll just round up with this word. You either pay the farmer or you come and pay us, the doctors. What I mean is, it's either you eat well, as he has advised, because most illness can be traced to nutritional deficiency, which made you prone or at risk to certain diseases. Okay, if you don't want to pay the farmer to eat well, you come and pay us, the doctors, and we will consult for you. But that aside, please, let's take our health serious. We want to live long and enjoy our children. We want to live long to fulfill purpose. We want to live long, stay healthy, and do the work of the kingdom. You need sound health for all this. So take your health very well. Make it a priority. You know what you should do and what you should not do. Praise God. What am I trying to say? Especially, I see a lot of youths here, maybe students in campus and things like that. We must be careful, especially during that phase of our life. Because there are certain damages you can do to your health when you are young that you have to live with for life. But that will not be your portion in the mighty name of Jesus. I will just rest my case here. If you have questions, don't die in silence. I think there are medical personnel in this church. Reach out to them. Thank you very much.
Thank you. Let's celebrate her. So, Ma, I don't know if you will have anything to speak to us in the word. This one is extra curriculum, but we can't just have you and, we won't get from you. Please, let's celebrate her.
Praise God. Actually, they've said everything. I'll just advise us once again to practicalize what they've said. And I pray that God will help us and give us the wisdom it takes to practicalize them. Thank you very much.
All right, so with a standing ovation, can we celebrate our panelists as they go back